Hi, it's Ginger Walker, and welcome to this episode of The Give Back. Today I have a special co-host with me, Sandy Grimes from America's Choice Mortgage, and I also have the Director of Children Programs for Capital Caring, Miss Tara Hoyt. Welcome, ladies.
Thank you.
Thank you.
So today I actually was introduced to Tara through Sandy, and Sandy and I worked together, and Sandy brought me in to meet Tara and introduced me to Capital Caring a little bit. So I'm actually going to put Sandy on the spot for a moment and ask Sandy how you came to know about Tara and what Capital Caring does.
Well, I've known Tara for, 15 years? Yeah, something like that. Our children go to school together, or went to school together, and we were both involved in PTO in Stafford, and we kind of lost touch when my kids graduated, and then Tara reached out to me and asked me if I'd be interested in sponsoring an event with Capital Caring. I asked her what the event was about, what the program was about, and she began to explain it to me, and it was something that rang very true to me. It was something that hit home to me. One of the aspects of Capital Caring is they work with children who've lost parents or siblings, and they help them go through the bereavement process. When I was 6, I lost my parents and was adopted ultimately at like 7.5 years old. But it was something that, had I had that back then, I thought, wow, that's pretty awesome. So I wanted to get involved because I know what it's like to have been there, done that, and I wanted to see what they were doing and to be involved in something that was going to change the lives of children going forward. So I was just wondering if you could tell me, had Sandy walked into your office, tomorrow, and having experienced the loss of her parents, what it is you all do.
Thank you so much. Your story has meant so much to me. And knowing you all those years, I never knew that story. So that goes to the point that many children are considered the forgotten grievers. People think that they're fine because they get up in the morning and go to school and play with their friends. But really, they're carrying this heavy, heavy burden of grief. So if little 8-year-old Sandy or 7-year-old Sandy had come in to us, maybe through referral through the school or a friend, we would have sat down, and the first thing we would say is, tell us your story and tell us how you feel about this. And for some kids, we are the only people that are asking that question. And so what that would do is that would trigger us to make a plan for this child, to see if there is a group that they would fit into, and definitely put them into our Point of Hope camp, which is our children's bereavement camp that we run at least once a year. Every neighborhood of Capital Caring has their own Point of Hope camp that they run. And this year is the first year that we are going to be able to have one camp that will allow children from all of our service area to come. So our bereavement camp, basically the goals of it are to teach children ways to express their grief in a healthy way. It's also to teach them coping skills for how to deal with grief on a day-to-day basis, how to rebuild their lives in the context of this giant loss that they've had. And more than anything, it's to connect them to peers, to kids who've been through the same, if not similar situation as them. And the only way that we can make camp possible is through sponsors like you and now the Give Back team. It's huge. First of all, let me explain how the hospice model works. Medicare and Medicaid and insurers pay for day-to-day medical care for hospice patients themselves. And part of their payment requires that we provide bereavement care to those families for 13 months. But there is no reimbursement for the bereavement care at all. There's a requirement, but there's no financial anything for that. So Capital Caring does not charge for bereavement. So we have to get that support through our community, through private donors, sponsors. And then Capital Caring takes it a step further and says, okay, even if your loved one did not die with Capital Caring, we still will take care of those families. So the children that go to schools in the surrounding counties find out about us through their school counselor, whether they've lost a parent or a sibling, whether it was a long-term illness or something sudden, like a suicide or a car accident. And those children are all invited to our Point of Hope camp every year.
That's
So-
awesome.
That's amazing.
That's awesome. Yeah.
So let me just ask and step back a moment. So Capital Caring, where you mentioned neighborhoods or different locations.
Yeah.
So where is Capital Caring? Where do you have offices or locations, and what
Okay.
areas do you service?
Absolutely. So Capital Caring started actually 41 years ago.
Wow.
And it was started by a woman who moved to America as a new widow with 6 children.
Oh my
Wow.
Her
goodness.
name is Josephine Magno. She has since departed. And she came with the idea that everyone deserves dignity as they're dying. And so her and a group of volunteers came together and formed what is now called Capital Caring. And they started serving people in their homes and providing not only medical care, but also that social and spiritual support. And that started in Falls Church, Virginia, which is where our headquarters is actually now. So we serve all the counties in Northern Virginia, all the way down to Richmond
Okay.
now, with the exception of a few far west counties right now, all of D.C., and Prince George's County, Maryland.
Wow.
And we do actually have one office in West Virginia, but I think it only houses like a few staff. So that's our service area, but it all started with a volunteer 40 years ago.
That's awesome.
amazing.
So
Yeah.
Fredericksburg has been here since 2013.
And that's where we're sitting today.
Right, that's where we are today. Yeah.
And so, as far as the types of people that you service, now I know that you just were recently promoted, congratulations,
Thank you.
to the head of Children's Services.
Yes.
So, are there different groups within Capital Caring that service different types of needs, or can you explain a little bit about
Yeah.
what services
So
you have?
the best way to understand it is that we help anyone at any stage in life, from infants to over 100 years old, with serious illness. So that means that if someone is facing a terminal illness or a life-limiting illness, they have access to our palliative care.
Okay.
So palliative care, it's different from hospice care only in that you do not have to have a 6-month or less prognosis of death.
Okay.
And what palliative care gives you is someone who's overseeing your day-to-day care, maybe managing that constellation of specialists that you're going to, whether you're a child, like I said, or someone who's over 100. And then you also get that spiritual and social support from our social workers and chaplains. And then if the illness progresses to a point where there's no longer curative measures available, then that's when the hospice care comes in.
Wow.
So, and that's, like I said, for all people. In addition to that, then we have the bereavement piece. And sometimes those bereavement services can start even before the loved one passes away, with service we called anticipatory grief. And our bereavement counselors and social workers may meet with the family to sort of prepare them for that. And then the bereavement services begin from there. And even though Medicare only requires that we serve bereaved for 13 months, we know that there's no expiration date on grief. And so some people we see for years.
Wow.
So, and that's because especially with children, as they develop, they go through their developmental stages, they re-grieve sometimes. So it's important.
So, do each family, do they get assigned a person that is their direct contact? Or
Yes,
so
absolutely.
how does that work?
So once the referral is made through the family doctor or the specialist, then the family is assigned a case manager who is an RN who oversees the care, and then there's also a hospice medical doctor involved in the care who writes the scripts and all of that. And then the rest of the team is comprised of licensed practicing LPNs and CNAs who come in and make daily visits if needed, and then social workers and chaplains and bereavement counselors as needed.
Wow.
Yeah, so it's a full team.
So, tell us a little bit about some of the opportunities if someone wanted to get involved with helping. There's always maybe a program that they can assist with,
Yes.
financial support, things like that. But some of the community events maybe that someone could join in and volunteer.
Absolutely. So the one other part of hospice that's really amazing and really important is that 5% of all of the services that we provide as a paid staff have to be provided by volunteers from the community. So we have a voracious and vivacious volunteer program in every Capital Caring neighborhood.
Wow. Nice.
So we accept volunteers. They have to apply, go through a background check, and go through our extensive training before they can do different things. So they can do anything from patient care volunteering to volunteering at Point of Hope camps. We have a lot of different events that go on throughout the year in every neighborhood. So there's that, and then also, becoming involved as a supporter and investing in our program, whether it's $10 a month to a large sponsorship to allow us to do the things that we need to do. For instance, as the director of children's programs, we have a pediatric hospice program, which I know is difficult to hear, but children do suffer from some illnesses that just don't have good outcomes for them, and for that, their pediatric care is provided by Capital Caring, but there are a lot of things that pediatric patients need that we can't really provide through insurance or through the hospice, and that's where we need a lot of support for special equipment, safety, things like that. So
that makes sense.
Yeah.
So if someone wanted to volunteer or participate or donate to Capital Caring, where would they find you? Can you tell everyone where they would find you?
So I think the best thing to do, depending on which area you're in, is just to go to our website, and there's a way to locate services and also to connect with us and give your information saying, I would like to volunteer, I would like to donate. And for the children's program, if you type that in, you'll find me. But I'm Tara Hoyt, Hoit, and I'm at thoyt@capitalcaring.org.
And you have a Facebook page too?
Yes, we do. Capital Caring has a Facebook page, so connect with us there.
Awesome.
Yeah. Thank you so much.
Thank you so much for letting us come in and chat with you a little bit.
Thank you for your support.
We appreciate it so much.
Okay.
Thanks, everyone.